Welcome to Living Well. We are so happy that you've joined us this afternoon to talk about a very important topic, and it's how to take care of our health through the ages. How do we keep up with our physicals? The last week, you may remember that we talked about how mothers need to take care of themselves, and that many times they're so very busy that they don't have time to take care of themselves. So we're going to share with you today at the different ages that we go through, the different stages, 20, 30, 40, 50, 60, what should we be doing for our health? Many times we don't go to the doctor unless we actually have symptoms. And today we're going to talk more about prevention. And what you can do is when you go to the doctor, how to be prepared to ask the questions, to share the knowledge that you have regarding what tests you like to have done. So remember, this Living Well program is for educational purposes only. We do not assess, diagnose, treat any medical, mental, any physical conditions. It's really just for educational purposes only, but you may hear something that may pique your interest that you want to know more about, and you can ask your personal physical, your doctor, personal physician about that. Today, Emma and I are going to have a conversation, but we will open the mic because I'm sure that you may have some questions. Welcome, Emmeline.
Thanks again, Dr. Sankey. Thanks. I'm glad to be here with you.
Well, we're going to start our conversation by talking about prevention. So, Emily, when you hear the word prevention, what comes to your mind?
Prevention. When I think about prevention, I think about basically preventing any sort of complication, any diseases from taking control of your body. I think about preventing diseases by eating right, exercising, getting enough sleep, all those things that are, the 8 health laws of health that we talk about so many times. That's what comes to my mind. I need to take care of myself so that I can prevent any disease or complications from taking place.
Well, Emily, what I have found is many times we rely on the doctor to tell us what we should have done at the different ages and stages of our lives. What are your thoughts about that?
Doctors are good, they are there for us, but at the same time, we need to be proactive. We need to take care of our own health. No one can take care of your body than you. So yes, you can always consult with your doctors about different issues you might be having, or before they even come about, you can talk to your doctor about it. But the key is getting to know your own body, listening to your body, and taking care of your body.
So at what point, Emmeline, do you think we should start really being serious about taking care of our body? I mean, many times they have these, recommendations when you turn 20 and 30 and 40 that we should do certain things. And so what are your thoughts about how can we educate people on knowing at what age we should be doing, whether it's just a lab work or a mammogram or a colonoscopy? What age should we really start paying attention to that? Because when we feel young and we feel great and we're busy, we don't really stop and think about that. So what would you advise as far as what age we should start really being serious about saying, when I go to the doctor, if he does not order this test, then I'm going to ask him if he would or she would order it for me?
Yeah, according to literature, it says by age 30, you start losing, muscles and you start deteriorating. So maybe starting at age 30, we should start seriously thinking about lab results, lab work that we need to get done. By then, we should be doing certain things like pap smears if you're female, mammograms, blood work that needs to be done, a complete metabolic panel, which means CMP, which is a complete metabolic panel that checks for your kidneys, your lungs. It checks lab that indicates kidney function, even your hypertension, and also your liver function. It also a CBC, a complete blood count, which also indicates or detects any kind of problems you're having with your like anemia, problems with anemia, infections. Those are some common lab work the doctor usually order. So those are some good things we can start off with.
You know, even as I was doing some research this week, Emily, I saw that in your 30s, you should also have the test that you mentioned, but also a thyroid function test. And then for men, they should have a testicular exam and even a skin exam in the 30s, you know, because many times we've been out in the sun, especially depending on what part of the country you live in, that you may actually have some changes in your skin, seeing spots, sometimes darkened spots or even lesions. And many times we can't see our back. We can see our arms, but we can see our face, but many times sometimes that lesions may start in some places that we cannot see. And so I think at the age of 30, as you mentioned, it's a good time to really have a very thorough exam, including lab work, skin exam, and even looking at your thyroid function. Because I hear a lot of young people say, I'm so tired, I'm so exhausted. And we, you know, maybe just by looking at or having the doctor do a thyroid function could be one of those things that would be helpful to help detect what could be causing the fatigue or tiredness.
Yeah, that's so true, because with the lifestyle that we are living today, so much stress, and stress is one thing that wears out your thyroid. The amount of the different chemicals that's in the atmosphere, the foods we eat, chloride, bromide, those are thyroid, killers. So those, and they know food abundantly. So sure, we need to always, get a thyroid test done. Very important. Yeah.
What about in age 40? You know, as we start climbing up the ladder, certain different tests are really needed for age 40. I was looking at even the bone density test for females, you know, as they get a little older, also still having the same test that they would have had for 30, but expanding it even a little more.
Right.
Density, you know, still having the pelvic exam, still having the mammograms, but again, making sure that even for males, having a prostate exam may sound a little young, but just a simple prostate exam to make sure that there's not any enlargement or anything like that.
Yeah, colorectal screening, that's also, I know we talked about that in the past, but that's also at a good age to start checking, especially amongst our the African American population or Black population. That's a type of cancer that is frequent in the Black population. So colorectal screening or ovarian screening for women over 40. It should start before, but that's another thing.
And I think a lot has to do with your family history, because even though we're talking about age 30 or 40, but if you have a family history of some type of illness or condition or cancer, it would be better to start earlier. And that's why when we go to the doctor, they ask for a thorough physical exam. They have you do your little checklist, your checklist, your assessment, and then they'll take you in the back, and based on what you've written, they will make a determination of what lab tests or what x-rays or diagnostic tests that you should have. And really what we're talking about today is screening tests, meaning that you don't have symptoms. We want to do it before the symptoms occur. So they're not diagnostic at this point because you have no symptoms, but they are screening.
Definitely. I know one thing we did not mention as yet is blood pressure. It's such a simple test to do. A lot of us maybe don't, especially when you're younger, you don't think about checking your blood pressure. But this is something that you need to check, get checked at least every 2 years or so. I guess they recommend from age 30, 20, at least every 2 years, get your blood pressure checked. Know your numbers, know your blood pressure, what's your normal blood pressure. So in case there's a problem, you can say, oh, my blood pressure is higher than normal, because blood pressure is very sneaky. It's called, it can creep up on you and you don't even know.
Right.
It's called a silent killer. So we need to really check on our blood pressure, especially amongst African Americans, Blacks, they need to really keep an eye on their blood pressure.
And there's a lot of people walking around with high blood pressure and they don't even know it. They have no idea. And so for me, I would expand it one step further, Emmeline, is, the question is, do you have a blood pressure cuff in your home? How many people do know who have one in their home? And should we all consider having one in our home so that we can check our own blood pressure? Because if you think about it, if I call today for a doctor's appointment, I don't think I'm going to get one tomorrow, or I won't get one Monday. It'll probably 2 or 3 weeks out before I get it. And if I'm not feeling well, if I have a blood pressure machine, I could take it at home myself, especially if I've been trained to do so. So that may be a tool in the home that could be a benefit as a prevention. Also recording your blood pressures.
I think I just said check the blood pressure every 2 years. I meant check risk factors. That's what I meant to say. Risk factors like your cholesterol, those factors that relate to blood pressure screening. But you can check a blood pressure anytime.
Absolutely.
But the risk factor, yes.
And
I clarify that.
I think as we age, our body ages. So we have to continue to remember that the heart's been pumping much longer by the time you get to 60 and 70. And so, like you said, really doing those screenings for those cardiovascular conditions to make sure that you're not going down that pathway of being maybe a stroke or heart attack or anything like that.
Right.
One thing I was reading this week about when you turn 50, not only having a colonoscopy, now that's one of those exams people are not really eager to raise their hand to have, but it does allow for early detection. And what we're talking about today is prevention. And so if you detect something early, it makes it easier to treat it. And so sometimes we wait till we have symptoms, and at that point, sometimes it's more advanced in stages. So we're not talking about waiting till you have the pain or the bleeding, or cramping or difficulty with your bowel movements. It's really being proactive in having the colonoscopy to look and see the inside of your colon. Are there any polyps? Are there any growths? Is there any bleeding? So that you can actually do an intervention. And I do know they also, I don't know if they still do it as much, but they used to do the occult blood stool testing to see if there was any blood, because you can't see with the naked eye, but it could actually be in the stool. So, yeah, the age of 50, that's when you really start to need to ramp up, and not just a simple, the lab test is the lab test and the colonoscopy and the prostate exam and the occult blood testing. But then at 60, coronary screening is important.
Right.
Let's talk a little bit about that.
What was that?
The screening for coronary heart disease.
Oh, yes, at age 60. So that's when it really matters with your cholesterol. Checking on that. I'm not going to go too much in depth in that because we have a lecture just on cholesterol. So very important in knowing your numbers and how to determine your cholesterol numbers. And that is so important. So, a stress test, an echocardiogram, those are good tests to get, just so you can have a baseline to know where you are, is getting that baseline. So if something changes, and your doctor will know what to do. So as I said, the cholesterol and EKG, always, get an EKG done and know where your EKG is at, your cholesterol, your stress test. Talk to your doctor about these things. Mention it to them that, especially if you have a family history of heart disease, you need to really sit down and start talking to your doctor about these different tests that you can do. An echocardiogram is not invasive, it's very simple, and you can do it at your doctor's office. Some doctor's office offer it, and get to see, the function of your heart. It tells you how your heart is functioning, how your heart is pumping. It checks your valves to see if there's any problems there. And it also can detect blood clots. If there's any blood clots in your heart, which can happen, people walk around not knowing they have blood clots. And those are good things to check on so you can have a good idea of where you are.
And what we're really talking about is an ounce of prevention is worth a pound of cure. So if we can prevent something from happening in our lives as much as we can within our control, that is what we want to do. And so when I think about as we get into our 60s, we're actually doing all of those tests that we did in the 30s and the 40s and the 50s. But one thing also that people don't often think about is a hearing test, making sure that they have a hearing test. And that is very critical, simply because we use our hearing for so many things. It's a part of our language. And if you're having difficulty hearing, that means you're probably gonna have difficulty speaking, it's gonna be communicating, you become more isolated when people are not able to communicate well. And so if you find that you're having difficulty hearing, it would do well to mention that to your physician so that they can order a hearing test. And then you get your hearing test and then they can determine what is contributing to it. It could just be a buildup in wax in the ears, it could be just that simple. Or it could be mean that you need some type of appliance or something to help you with magnifying the sounds and the hearing. And so when we get in 60s, then we get a little bit more in depth of looking at more detail of what we actually should be having, what type of tests that we should be having done. So that's something to keep in mind.
Yeah. Also, I was thinking about inflammatory, like C-reactive protein. These are inflammatory markers that can help, determine if there's any inflammation going on in your body. Inflammation is one of the leading causes for so many chronic diseases. And if we can keep our inflammatory levels down, we will be able to live a healthier life, feel much better. Aches and pains, we will be able to keep them at bay. So talk to your doctor about inflammatory markers like C-reactive protein, the rheumatoid markers, those kind of markers we need to look into so that we can maybe help with inflammatory processes, especially if you're having symptoms like pain, a lot of pain.
Emmeline, now that you've talked about markers and labs, what about now we've talked about what you should have done through those different ages, but now we've had them done. Let's say we've had the test done. How do we understand the lab results? We get back to, let's say, the comprehensive panel, we get back to thyroid function. Now how do we, when we go back to the doctor to get the results, what are some of the things that we should be mindful of or be ready to have a discussion about?
Right, so the major two blood work doctors usually order are, as I mentioned before, complete metabolic panel, which is a CMP. It checks like 14 different functions in the body, electrolytes and electrolytes, it checks your kidneys, it checks for liver, and all those different 14 things that they check can determine all of, what's going on with your body, your kidneys, your liver, and your metabolic process in your body. And then you have the complete blood count, which is a CBC that also checks for your hemoglobin, your hematocrit, it checks also your white blood count. So these are markers that can give the doctor a variety of variants of what's going on in your body. So the thing about it is when you have these tests, look for things that are out of range. I cannot give you, what a CBC should be, because it's like your red blood count, because it can vary according to lab. From lab to lab, they have the variant. So look for, what you need to know is look for markers that are out of range, because they will tell you if it's too high or if it's too low. Now, if you have like a CBC, you have the red blood count, white blood count, platelets, and the differential. Those are things that that it checks for. But look for your RBC. Is it low? I'm sorry, is it low? If it's low, it could be indicative of maybe anemia. If it's too high, maybe you have too much red blood cells. And what that could do, it can start clumping. Your blood cells, your blood flow will not be as effective. you can start having a shortness of breath, tiredness, chest pain. All of that could be indicative of a low red blood count. So look at the numbers and be very careful when you go to your doctor. Sit down and talk to them. Have them explain to you all the different low or high results. Now, if you have a low or abnormal blood count, that doesn't mean that there's a problem. It could be simple dehydration. Sometimes when you're dehydrated, you can have blood thickening. It can be your hemoglobin can be, hematocrit, I should say, can be too low. So let your doctor sit down and explain these levels to you. Just don't take them and then think that, oh, everything is okay because the doctor didn't mention anything. Sometimes, they can overlook things. I know I've gone to the doctor and after leaving, I realized, oh, this was abnormal, but they did not mention anything. And I'll call the doctor back and they said, oh, I didn't realize that. And then they order further tests, because sometimes some of these tests we need to do further testing to be sure that something is not wrong. Or platelets, that's another thing that that's your complete blood count will check. Your platelets. Now, your platelets are very important because that helps with clotting of the blood. If it's too low, you can bleed excessively if you have a cut. If it's too high, then again, blood will tend to clot and you can start having blood clots in your arteries and throughout your body. So look at the numbers again. If there's anything out of the norm, talk to your doctor, because in the results, it clearly will tell you what is high and what is low. So look and decide what is high, what is low, and talk to your doctor about it. Now, the white blood count, I'm telling you, white blood cells tells a lot about what's going on in regards to inflammation, infection, parasite, even if you're having a reaction to something, your white blood cells can tell you all of that. The white blood cell, the neutrophils, that's the most common blood cell. Neutrophils may increase if you have a bacterial or fungal infection, and you have the lymphocytes, which also will determine your immune function. It regulates your immune system, and it can increase if you have something like leukemia. Your monocytes, which may be increased also if you have leukemia. Leukemia is a form of cancer of the blood. Eosinophils can be affected if you have some parasitic infection, and basophils can be elevated with some forms of inflammatory damage to your body. So again, discuss these abnormal results with your doctor. Make sure that these are addressed, and the doctor can order further tests. If he sees there's a problem, he can order further tests. We're trying to keep things at bay where it doesn't get too out of hand. So know your levels. So that's about CBC.
Emma, you know what? Many times when you go to the doctor, at least when I've gone, they seem like they're just in and out for a short minute. I mean, they're there maybe 5 minutes, you maybe can get 10 minutes out of them. But it seems like when we go back to the doctor, and again, this is for our, I'm going to call them wellness checks. When we go for the wellness checks, or so that we can, well, we're going is because we're not having symptoms, but we want to make sure that we know all of our numbers about the white blood cells, what they do, the red blood cells, they're in and out. So I think, like you said, it's really important to say, you know, what is this? Because sometimes the doctor say, oh, it's elevated just a little bit, or it's down just a little bit. Those are the terms that they'll use. But I think we want to clarify and say, what does a little bit mean and what could be contributing factors? Now, what I do know is sometimes it's the medication that we're on that are affecting those lab numbers. Like if we have those platelet counts or anything like, sometimes it's medicines that they put us on, or if they do a CDC, if we're on some type of diuretic, or, that's going to affect our numbers. So I think when we go back for lab results, we need to be prepared to share with the doctor what medicines we're on, and ask the question, are these medicines affecting my lab work? Potassium, if you're on steroids, that's going to affect your lab work. If you're on any type of blood thinners, Coumadin, warfarin, any of that stuff, it's going to affect the lab work. And we can't make the assumption that the doctor remembers that we're on those medications. What are your thoughts about that?
Yeah, that is so true. I'm glad you brought up medication, because the doctor put you on a medication, for example, for your blood pressure, and they gave you a diuretic. A diuretic is a medication that makes you urinate frequently, so they can, help get rid of fluid. And once you're urinating, what happens, you are excreting your sodium, your potassium, which are very important. You need potassium to help with the contractility of not only your muscles, but also their vessels. And if you do not have enough potassium, it can be at a low point where you can even have a heart attack, because the low potassium level is not causing the contractility of the vessels, is not causing the firing of those electrolytes that are needed to help to stimulate the heart to beat. And you can have what we call abnormal heart rhythm. And some of those abnormal heart rhythm could be lethal. So you're very important, if you're on any type of diuretic, check your potassium level, keep an eye on that. Know what signs you can have if you have a low potassium. Cramping is one of those things that can take place if you have a low potassium level. Sodium, another thing that we need to keep an eye on. Our sodium level, if it's too high or too low, it can be a problem. On magnesium is another thing we need to be careful with. Magnesium and potassium are key elements for contractility of our blood vessels. So magnesium is another thing we need to keep an eye on. A lot of time when we do a complete metabolic panel, we will have that magnesium in there. But if the doctor just order if he doesn't order complete metabolic panel, then you will not have that magnesium, and you will not know what the magnesium level. So ask them to do a magnesium level, especially if you're on those diuretics. You talk about steroids. Steroids are very, they decrease your immune system, so therefore they can lower your white blood count, make you more prone for infection. So you have to be very careful if you're on steroids to be careful with infections. Can also increase your blood sugar level. Steroids is known for doing that. So you might have a high blood sugar level and not knowing why you're having a high blood sugar level. It could be the steroid medication that you're on. So as Dr. Sankey said, let your doctor know what medications you are taking, because they can't forget, because they see so many patients and they can't forget exactly what you're taking. Sometimes they order something some months back, and they're looking at the records, and maybe that is not showing up, and not realizing that you're on this medication and it's causing a problem.
And one thing that we don't talk about enough is our family history. What is in our family history? What did our parents and grandparents and great-grandparents have? And then many times we end up having the same, or being at risk for the same types of conditions. And because we don't know that in our family, when it shows up on our lab work, we're really not aware of that. So, there's a saying, what you don't know won't hurt you, but that's not true, because what you don't know about your family history of medicine or medical history could possibly affect you and harm you. And so I think what we want to make sure is that when we talk about prevention, is that we start with understanding our parents and our grandparents, what are some of the conditions they had, particularly cancers, something like that. I mean, sometimes cancers, it's such a secret, people don't talk about it, but we need to really begin to talk about it more, because then we can start the screening earlier, and we can possibly have an early intervention. And some things you're not going to be able to prevent, but you can make lifestyle changes so that you can reduce your risk of having the magnitude of maybe what your parents or grandparents or great grandparents experienced from those conditions. So I think what we're trying to really project today is that every age, as Emmeline said, we should be, even at the age of 20, even though we may not think that we're at risk for anything. I do know 20-year-olds who have had breast cancer. I know 30-year-olds who've had colon cancer. I've known, and it wasn't necessarily family history. It just popped up. And so, and even when we think about even hypertension and diabetes, we're seeing more and more of that. Our nation, for various reasons, our diet, number one, our lack of exercise, number two, are reasons that we are struggling with these conditions earlier on in our lives.
Yeah, that is so true. I cannot emphasize enough of diet. Our diet have changed so much from when our parents or grandparents were growing up, because we have, we have so much chemicals now added to our food, and these things affect the body, especially the kidney, because anything that we consume, the kidney and the liver. Anything that we consume, the liver has to detoxify it and the kidney has to excrete it. So we are having more fatty liver in our society today compared to years ago. And even in people who never drink, because when we hear about liver disease, we always think about, oh, they're alcoholics. That's why they have a liver problem. But now people who never, consume alcohol now are having hepatitis, liver disease, and it's all because, not hepatitis, but cirrhosis of the liver, I want to say, I'm sorry, but it's all because of our diet.
So, when we think about the quality of the food, the quality of our air, we should be very concerned and take the precautions that we need to ask our doctors for certain tests, because we do know that we don't know what's happening inside of our body. And we don't want to wait until the body begins to, have symptoms and aches and pains, before we actually begin to take action. And so what we're talking about today is let's prevent, let's reduce our risk. Let's be proactive. Let's be proactive in taking care of our health at the age of 20, 30, 40, 50, 60, 70, 80. You're never too old to make lifestyle changes. I think that's one thing that I would drive home. Even if you're 70 or 80 or even 90, any lifestyle change that you make for the better is going to actually be better for you, because it's your quality of life that you want. Long life is great, but quality of life and long life together is even better. And so that's what, God in the Bible, he made it very clear. He never expected us to die. He never wanted us to die. He wanted us to have the best life. And so what we have to be mindful of is, what do we do? What can we do? He's done his part. What can we do to take care of our health and be good stewards of the bodies that God has given to us? Because we're not our own, we're bought with a price. So I think, just taking a moment to say, and I would say to anyone who's like wondering, what should I be having done right now? There's a wealth of information on the internet about the different ages that Emma and I just talked about, of what you should have done at those stages and those ages. I would say go there, look at that list and say, have I had this test done? And if not, when you go to the doctor the next time, you ask the question. I was reading some literature and it says at the age of 60 that I should have this test done. That's something I like to have done. Sometimes it's an extra cost out of pocket, may not be covered, but again, it could be, and you just don't know it. And so I would just say, ask the question, let them answer, and then you can make a decision based on the information that you have.
Yeah, a lot of these screening tests, insurance do cover, because they prefer to prevent something from happening than to have to treat the individual for whatever condition that might come up because of not checking, So it's a good idea to go talk to your doctor.
One thing I forgot to mention, Emma, is the eye exam. Many times we don't think, I mentioned the hearing, but I didn't mention the eye exam. And we're going to actually invite a physician on board to talk about the importance of your eyes. When you go to the doctor, what are some of the things that when they look into your eyes, not that can you see the letters on the eye chart, but there are health conditions that they can detect simply by an eye exam. And so I'm not going to tell you all about it because he's going to come on, he's going to talk to us about it. But I want you to remember that those are things on your checklist of things to do each year, is to make sure that you get an annual exam and make sure it's a meaningful exam, meaning that you get the things done so that you can know what's happening inside your body that you cannot see. You know, we have about 7 minutes left. I think we should open it up for the audience because I think we could keep talking, but they may have some questions. I don't see anything in the chat box, but I do want to just open it up for questions. There may be some questions that someone may have. Any questions?
I don't have a question, but I was gonna say I just had that stress test in the heart echo, whatever you said, done actually yesterday. It's
Okay.
not it's not an easy test to get your insurance company to pay for because they denied me the first time because my primary care requested it because I told them I was having chest pains. And they said they sent it to a third party company that said they didn't see no indication of me needing it. So they denied it. So he had to refer me to a heart specialist so that the heart specialist could request a test for me to get it done. And that's how I ended up getting it done. I had to go see a heart specialist. And after I seen the heart specialist, he said, I don't think anything is wrong. He said, but your doctor is concerned. So I'm gonna go ahead and do the test just to make sure your blood is flowing okay. You don't have any clogs and everything is going in your valves and stuff are pumping okay. So some of these tests, like she said, and they not cheap because I still had a copay of $500. So ain't no telling how much the test was. And I think that the insurance companies are a big ripoff because you pay insurance when you work every year, all year long, and you hardly ever use it. And then when you use it, they deny you. And you don't pay for the test over and over again, probably if you don't work over 5 years. And you're just getting that test done. And I actually had the ear test. I didn't know anything about getting your ears tested. And I ended up getting my ears tested because I told them I had some fluid in it and they thought there was some kind of object in it. So I went and had my ears tested and they found out wasn't anything wrong with them. So I didn't know anything about those tests. But for some, I guess that was the God intervention right there that I got both of them done before y'all brought them up today. And but you still, those insurance companies, they don't want to pay for stuff. And it's not fair to the person paying the insurance to have to pay for a test that is necessary at a certain age. I don't think.
Yeah. You know, Linda, that's unfortunate that we have to deal with the insurance company. The doctors order the test. The doctors are the ones taking care of you. But then we have these insurance companies who come in and say no. So I don't know what to say in regards to that. But if you can afford to pay for it out of pocket, it's just best to go ahead and do that. Yeah, I'm glad you were able to get that test done because it's important. An echocardiogram shows so much. It can, you know, it can tell about, especially someone with high blood pressure. I always tell someone with high blood pressure really needs to get an echocardiogram done because it can tell if that heart muscle is enlarging, that left ventricle, the left side of your heart. It can tell if that heart muscle is enlarging. And if that muscle gets too enlarged, it will affect the pumping mechanism of your heart. Your heart will not pump blood effectively. You're going to end up with other complications like congestive heart failure because now the blood is backing up into your lungs because the heart cannot pump effectively. Maybe the doctor, knowing that, can change the wrong time of your medication that can help with the pumping mechanism of your heart. It can tell the valves, you know, especially someone who had scarlet fever as a child, they can end up with valve problems as adults. If you have, you know, any changes in the sound, if a doctor listening to your heart and they hear any detect a change in the way your heart's valves sound, they need to order echocardiogram to see what's going on with your valves. It can detect so many different things. And I think it's a test that is essential for someone up in the 60s, so they can have a baseline what their heart condition is like.
Well, Emily, I like the word baseline. We need to know our baseline, because if something changes, then we can say it started out here and now there has been a change. And I think that's important, that we keep stressing the importance of prevention, screening before you really have to, before it's necessary. I see your hand, Alicia. You have a question?
Yes. Well, I have had echocardiogram done already, but what I want to know is how often should that be done?
Mhm. I think that's going to be determined by the doctor, because it depends on what the initial echocardiogram shows. If he saw that there was a problem, he might want to repeat it the following year. If there's not a problem, maybe it can be longer before repeating it. But it boils down to what your doctor says.
Okay.
One thing that Linda mentioned that I really want to stress, if your primary doctor orders a test, your insurance company refuses it, then maybe see if you were referred to a specialist, if then now it will be accepted. So sometimes we have to think of because if the doctor orders it, you may say to the doctor, should I be going to a specialist for this? He may say no, but you actually have a right to, if you want to, if sometimes you can do self-referrals to a specialist on your own.
Yeah.
Taking charge of your health. It really is. Because I'm telling you, if we don't take charge of our health, like Emma said at the very beginning, I agree wholeheartedly, who is going to take care of us? Who?
Yeah. Yeah, that was a good idea that the primary care Dr. Linda decided to go through a specialist, because sometimes that's how we get these tests done, by a specialist requesting the order.
And I'm actually glad they did it, because women, many times when they have heart conditions, it's not detected early. So it's very subtle, and many times we ignore even the symptoms, but you paid attention to your body, you knew it was different and out of the ordinary, but sometimes it's subtle. So even though the doctor may say, oh, I don't think it's anything, you're young, you're this, you're that, they don't know your body like you know your body. So it's better to have it and get a full checkup, know what the heart valves are doing, what the blood is pumping, and then you can go from there and actually have at least that baseline from that particular test. But I think we should never minimize or brush off when our body speaks to us, because it could be an indication that there's something else going on. Maybe it's not the heart. Is it something else though?
Yeah. It's especially as you mentioned, Dr. Sankey, women, heart disease or heart attacks are so subtle in women. It doesn't, mirror the same symptoms like a male and what we see in textbook. So, especially for females, we need any type of shortness of breath. Sometimes we don't have that chest pain that they describe that causes heart attack. Maybe it's just a shortness of breath, tired, just not feeling yourself anymore, could be a heart attack that's going on. So it's good to check it out. And I cannot commend you enough, Linda, for having that foresight to go to see a doctor and let him know what's going on.
Good afternoon, everyone.
Good afternoon.
Good afternoon, Josephine.
Yeah, just something I want to say concerning getting tests done. I want us to remember that there are pathological ranges. That's the range you get when you go for your blood test at the lab. And then there are functional ranges for lab tests. Normally, they are different, maybe by 1 unit or something. So even though they may say you have high cholesterol from the lab test, functionally, it may not be so. Or your hemoglobin, your hematocrit, all of these things, just remember that there are two tests, the pathological range and the functional range. Because some people's body may function at one level, and then another person may function at a higher level, and they're okay. So we are all individuals, we are different, and our lab results won't be the same. What you may call high for you may not be high for me
Mhm.
as individuals. So keep that in mind as we do our tests.
Great.
Thank you for bringing that up, Josephine. That is so true, functional and pathological. So what I do when I look at my lab work and I see that I am more close to the low end or close to the high end, I try to get in between that mean. I'm not too high or not too, I'm not to the close high or close low. That's one way you can look at it too.
So I don't see any more questions, Emmeline. Any other questions? We'd like to give everyone a chance. So we are right at our time. It went by fast today. One thing I would say while we're waiting to make sure there's no other questions is, Emmeline, you mentioned that when you were reading your results and you had left the doctor's office, you realized that there was one out of range.
Yeah.
And you call back. And so what I would say to everyone, they hand you the paper, they say they go over it in the office, but when you get home, or even before you leave the office, look at it one last time to make sure that you have had an opportunity to ask the question or understand why your labs or whatever report, whether there's an x-ray, mammogram,
Right.
lab work, just make sure that you understand. And if you get home and you have more questions, I would have, as Emmeline did, to please call back and ask those questions, because it's almost like when they hand us the paper, we just fold it up and put it in our purse. We don't look at it, just believe that what they told us was what was, but it's about taking charge of your health. And that's what we're really saying, do that so that you can, I go to the doctor, I have a doctor's appointment next week for my annual, and I'm taking this advice or my own advice, what is it that they should be checking at the age of 60, and then when I get my lab results, what are they saying? Because if we know what they're saying, then we can do something about what they're saying most times, right? So that's why you want to understand why they're saying what they're saying regarding, your levels. I don't.
Yeah, and yeah, I was gonna say, and I know it's okay to question your doctor, to ask questions, because I know sometimes those results comes back and they have all these big medical terminology you don't understand. Let your
Mhm.
doctor break it down for you. What does this mean? Because I know it was an X-ray result, X-ray I did, and the doctor, all what she read was a summary of what the X-ray said. But I started reading through the X-ray results, and I picked up something, and I'm like, okay, this is saying this. If this is saying this, don't we need to do further tests? And so when I brought it to her attention, she was like, oh, okay, sure. And she ordered further testing. So if you don't understand something, question them.
Last question.
It's your body.
Absolutely.
You're paying for this visit. You make sure you make good use of it.
And Linda makes a good point. We pay for insurance, and when we are insured, we've already paid for it. So the doctors are getting paid to answer our questions. So,
Mhm, mhm.
but anyway, well, thank you all for joining us. We have some exciting
Did
topics.
I just give a personal experience with a doctor? too?
Sure.
It's amazing that doctors don't pay attention, as Emmeline is saying. When I went to the doctor last year, probably February, she's telling me, oh, I need to lose some weight. My A1C is going up. And then when I did lose the weight, she didn't even recognize I lost the weight.
Mhm.
Because every time you go to the doctor, they weigh you. And I lost about 10 pounds, and the doctor didn't say blame, as we just say back home. She didn't realize I lost weight. And she in her notes, she said that I need to lose some weight, but she didn't tell me personally. She wrote it in my notes.
Mhm.
And
Yeah,
when I did lose the weight, they're not observant.
yeah. Yeah, because they just rush. They have so many patients they
Yes.
need to see within a time frame that they just rush. And what they will do, they will just refer back to their old notes, copy paste. I know that's what they do. They copy paste and put it, and that's it. They do not take the time to actually go over step by step and review your whole history, review your lab work. They do not, because they are
That's
so
sad.
rushed.
Very
Yeah.
sad.
Yes, yes, yeah. If you can, I'm telling you, if you can afford it, because I do not go to a regular doctor. I go to a functional nutritional person, doctor, and it's different because they take time, they order slower lab work, and they take time and go over everything with you. It's not as rushed. I feel it's not as rushed as if you go to a regular doctor who just rushed through things. One thing before we close, I want to close with this. Sleep is so very important. I know we talk about all our lab work and all of this, but sleep can affect all of this. If we, just sleep, because sleep causes, stress. If you don't have enough sleep, cortisol levels, and it just causes a whole slew of other problems. So I want to leave with this. Make sure you get enough rest.
Thank you so much, Emma. So we've talked about a lot today, and we really were talking about keeping our health, staying healthy throughout all the ages and the stages that we go through in life. In the Bible, and this text is kind of like out of context, but I want to mention it. It says, I've been young, now I'm old, but I never seen the righteous forsaken or his seed begging for bread. So throughout our lives, if we see how God has sustained us and provided for us physically, food, he will do the same for us for our health as well. It is important that we still take charge of our health, that we are good stewards. So number one, I would say find that chart that has all of the different ages and go down that checklist and say, have I had this done at where I am in my life now? The next one is keep really good records of your own lab results and your health results and your health tests. Everybody should have a folder or something that they just slip that information in so that you'll know what your baseline is and if there have been any changes. Also remember that it's okay to ask questions. You should ask questions if you don't understand. And the reason you're asking questions because you want to know what you can do to maybe change that lab result. Do I need to drink more water? Do I need to get more sleep? Do we need to change that medication? Do we need to stop that medication? Again, it is okay to ask questions. And then most importantly, do all that God requires us to do. Eat right, drink right, sleep right, get fresh air, get sunshine. Do all of those things, and with God's help, we can be the healthiest that we can be and live life abundantly here on earth and then prepare for eternity. Thank you again so much for joining us. We are going to pause right now. We're going to pray. And so if you have any prayer requests, we would absolutely love to hear what those prayer requests are.